So, good afternoon. Yeah. Okay, my name is Dr. Peter Kinyajui from Mariakani Sub-County, Kilifi County. I'll be taking you through the prevalence and practice towards rational drug use at Mariakani Sub-County. So I'm based at Mariakani Sub-County, Kilifi County. So I have my co-presenter, she's also here, Dr. Niram. Probably she can just wave. And together with the other Kilifi team, Dr. Walda. So we are a bigger team from Kilifi. So the rational drug use is essential for achieving the universal health coverage. And for the LDU, we are talking about appropriate prescribing, targeting at the prescribing, the dispensing, and also the use of medicine. As we know, irrational drug use, it has consequence, especially with the antimicrobial. So we did a study at Mariakani Sub-County with the help of MTABs, Dr. Nkada, they supported us to do the study. So we are checking the practice and the prevalence of rational drug use. So we shall see even a component of antimicrobial. So our objective, we had two objectives to assess medicine use pattern in the outpatient. So for us, we did the outpatient. So, and the second one to determine the level of rational use. So remember, we are checking the prevalence and the practice. So our key indicators per the WHO, you can see on the left side, there are 3 indicators: the prescribing indicators, the patient indicators, and the facility indicators. And besides, on the left and the right side, the prescribing indicators. So the WHO has recommended a minimum of 600 prescriptions per facility. So our reporting time was 2021, July to June 2022, and we had a total of 6,000 prescriptions. So we were taking every 10. So the study was done in Mariakani Sub-County, Kilifi County Hospitals, and Malindi Sub-County. So, but I'm only presenting for Mariakani. So other facility, because they have a bigger workload, so for them they had a bigger indicator. And the second indicator for the patient indicator, which was a prospective study. So we sampled 100 patients that were coming to the outpatient, and also the facility indicator. It was also a prospective study that we were checking the availability of the 22 essential medicine lists. So we shall be seeing. So the key indicators as per the WHO. So we shall be going for the first indicator, which is the prescribing indicator. And the sociodemographic characteristic, we had more male, over 18. So you can see 73%. So for children were 27. And in terms of gender, the male and female, we had more female at 67%. So you can see majority of the female, they visit our facility. Next. So the key finding for the prescribing indicators, the 600 prescriptions that we analyzed for the last 1 year. So medicine prescribed by generic name. So it was at 74%. So the prescribers, they are still using the trade name, which should not be the case. So you should be having 100% of drugs prescribed by generic name. The second indicator, medicine prescribed from the essential medicine list. The latest is 2019. So 95, some they were going beyond the essential medicine list. And prescription with over 1 antibiotic, which is very key, because we are talking about antimicrobial resistance. You can see the usage is at 69%. So it's like for every 6 to 7 patients out of 10, they are working with an antimicrobial. And the WHO has recommended it should be less than 30. So actually, the WHO has recommended between 2 to 3 patients per 10, they should be working with an antibiotic. They should be prescribed an antibiotic, but you can see in our case, so it's either there is irrational use of antimicrobial, which could be either misuse or abuse. But now we shall see part of the discussion how we are treating that 69% to reduce it down. The other indicator is total number of antimicrobial prescribed. There was 445. The injection that was prescribed 6%. This was for the outpatient. And average medicine per prescription, so around 2.3. So it's around 3 drugs per prescription. So the percent of injection encounter was 6. medicine prescribed by generic, as we have seen. So that's the prescribing indicator. Next. So, and this is also very important when we are talking about antimicrobial, because now we are talking about the resistance. It's a global concern. And you can see within Mariakani sub-county, amoxicillin. Yeah, amoxicillin is on the highest, followed by amoxiclav. Now you can see the trend within. So top 5 prescribed encounter for 75%. So a lot of, you can see the top 5 within Mariakani. So there is a selection pressure. Next. So the patient indicator, out of the 100 patients that we did, now the second indicator for the patient, 73 were adult, peds were 27, and also for the female were less. For the patient indicator, we had more male, 51%. Next. So, and this is also very important when you are talking about MTM, the medicine therapeutic management, the average dispensing time. Are we spending with our patient at the pharmacy while we are dispensing? The WHO has recommended about 3 minutes, but we can see we are spending 175. So we are spending less time with patient, which should not be the trend. The average consultation time, it's above 10 minutes. I think the outpatient, they are doing well. The total number of prescribed, you can see, and total number of prescribed, it's at 91. So we are hoping probably through the county, through KEMSA, and also meds, we should be able to be having our medicine so that patient can have 100%. In terms of labeling, 92.6% could understand whatever was labeled or how to use the drugs. Next. And the last one, or the facility indicator, out of the 22 medication, by that time we had 19, 3 were essential, and 2, we had 2 antimicrobial that was not there. So, and the 2 of them is benzene expen, together with the amoxil 500, it wasn't available by that time. So I think those are the findings. The next, that's a photo gallery for Mariakani, the outpatient, the data collectors within the pharmacy, the data collection tool, and the data analysis when we were doing. So I like to acknowledge Kilifi County through the support of the county antimicrobial focal person, Dr. Aisha. She never managed. There is another workshop she is going on. Mariakani Sub-County Hospital, I sit in the Medicine and Therapeutic Committee, the AMS Committee at Mariakani, and also USAID, MTABS, followed by, led by Dr. Nkada. We do appreciate all those for the support they give us to carry on the study. Thank you.